bring about generational change with new solutions, innovations to benefit people at the grassroots level, administrators, health providers, research community, to really achieve the desired affordability, sustainability, and scalability. I think that is the challenge. I am a bit on the potential, but I am very concerned about our ability to execute. We just don't have the leadership that we need to execute at various levels in the government. I do find the leadership in the industry, but again, that leadership has to focus on the larger challenge at the grassroots level and not on the top of the pyramid. I know the timing is right, and I know that the need is very large. Without focusing on health IT, we are not going to be able to address the challenges for universal health in India. But again, I want to remind that IT is not panacea for all health initiatives. We must focus on improving existing infrastructure. We must improve human resource. We must focus on integrating traditional medicine, make lifestyle changes. Look at the challenge in diabetes in India, like the challenge in obesity in some of the advanced countries. How do you deal with diabetes without making lifestyle changes? How do we teach our people a little more about good eating habits? How do we convince people to exercise, meditate? I think a lot of these challenges need to be integrated along with health IT. So when we talk about creating a portal at a national level, first it has to really integrate all of these things and not just high-flying drugs and medicine and surgeries. The Indian health portal must integrate traditional medicine, lifestyle requirements, and it should be available in all Indian languages. If we are not focused on Indian solutions, Indian model, Indian content, Indian languages, there is no way we can take advantage of the health IT. So on one hand, we need to focus on mobile phone because that is the instrument of access and delivery. Take advantage of the national broadband connectivity in the next 18 months and then focus on really Indian model of health ICT, which once again would begin, according to me, from very simple primary health record, patient health record, connecting through mobile to telemedicine, then to the health management systems. But the portal is going to be the repository of all kinds of health knowledge. Today I can't go to one place to really find all my needs for health information. I need to be able to go to one portal with all Indian languages to find not only the understanding and information about a disease or the problem I have, but also connect me to the resource I need. Connect me to the right diagnostic laboratory, like doctors, like hospital, give me all the options, and it should be easy to navigate. A great deal of thought has gone into all of this, The challenge is to really implement a lot of it in the next 5 years. I hope that collectively as professionals, medical doctors, business community, IT professionals, government, and others, pharmacy, laboratory people and others, scientists, could come together and really pressurize government to execute on this in the next 5 years. I do not see any hope without proper IT to really address the health challenge we have in the country. We know we have the answers. We just don't have the will to go execute on an urgent basis. With this, once again, I want to thank organizers. I see Dr. Pratap Reddy in the audience. Good evening, and thank you for all the work you have done and the leadership you have provided in the country. And I know you and I had a conversation earlier on the role of health. A great success, and I hope we can carry this forward. Sangeeta, thank you.
Thank you so much.
I can't hear you.
They're clapping loud enough for you to hear in Chicago, Sam. It's such a pleasure to see you. I thank you so much. I know it's early morning and you've been traveling so hectically, but I think it's your passion for the subject and for the country that makes you do all the amazing things that you do. You spoke about the health portal.
Thank you for people like us alive. Without you all, I tell you, I would have died 3 times.
Yeah, your medical history is truly an amazement. So,
I was just saying that audience probably doesn't know that I had 2 quadruple bypasses.
I was just going to say that, and multiple stents as well, I believe, in between. But
4 stents.
4 stents, so continues to
and
travel.
Cancer. And cancer. So thank you.
Dr. Reddy says an amazing medical history for an amazing man. So to the amazing man of healthcare IT in India, on behalf of the entire audience here, first a very big thank you. Second, a huge request, because everything you spoke about is something that over the last 2 days, over 1,000 people have been deliberating. We had amazing models. We need to understand how to scale. We seek and need leadership from the government, because to scale, we need that leadership, we need some infrastructure, we need standards, everything that you spoke about. So we also signed the Cyberabad Hyderabad Declaration, which we will be bringing to Delhi, seeking an involvement of the government to quickly legislate or help us on the choosing of standards, and also to kindly allow the National Knowledge Network to be available for the private sector, whether it's in teaching or it's in reaching out to patients in the rural areas. All these are part of this declaration. We know that you're back in Delhi on the 18th. Many of us as a subcommittee of this conference will be seeking an appointment to request your input and involvement. Thank you very, very much on behalf of the whole audience. Dr. Reddy.
Thank you again, Sam. I think during the course of these 2 days, you must have been mentioned several times, because you brought that first revolution. We want to be with you when the second revolution comes. And you know the health challenges are so huge. We will address many issues that you talked about, but I think what's needed is to see how quickly we can get along, work together to participate. Actually, the declaration that Sangeeta has referred to, which we are going to bring it to you, is made by the providers, all other connected health workers, to saying that together we will want to make the difference. We want to use the IT to go to the next level of care that the people need, to bring the personalized level of care. The electronic medical records, you have very clearly said, we will work on this. We're not as elaborate because it's not possible, but what is needed is good medical records and personalized. And the Chief Minister of Andhra Pradesh was here. He reiterated his commitment. We would like you and the government of India to support this initiative, that together we can work together and bring this change, which is very necessary, because you know the health challenges today is too huge to be pushed aside. Thank you again. As I said, again I repeat this to everybody, you have an amazing medical history and you are an amazing man. So I think with these two, let's guide us, healthcare, to do these amazing things for all people. Thank you very, very, very much from all of us, Sam Pitroda. Thank you.
Thank you. Thank you for your leadership, and thank you for all the things you have done in the healthcare system for the country. Thank you. Really appreciate it. And we'll connect, Sangeeta. I'm back on 11th. Give me a call and we will take this forward. You have all my support. Thank you. I'll sign off unless you have questions. Okay. Thanks.
Thank you so much, sir. Thank you. We'll continue. We have two speakers. So sorry to the other speakers that we kind of interrupted. We will finish without program.
That was...
and then expect to get fixed. Hang on, this is the wrong one. We seem to be having a lot of technology challenges here.